Ukimaliza unisaidia na ile taa ingine. Yes. Yes, welcome. Today we want to talk about something about antenatal. Welcome, Jamaican uncle. Blessings to you, Benjamin, and everyone who are here in the stream. Welcome. Antenatal care. What is antenatal care? What is antenatal care? Someone may ask you, what is antenatal care? Let's see what is antenatal care. Antenatal care. When a woman has conceived, before the woman delivers, that is what is called antenatal. After delivery, it is called postnatal. So we want to talk about antenatal. Ante is the care you give to a woman when the baby is growing and is in there. There was a time we talked about neural tube complications. Neural tubes complication. Let's remind ourselves something about what we discussed that is entailing this antenatal care. We talked about something called, when people get neural tube complications like autism, ADHD, some complications like those ones. We talked about them, and I just came from back and work in the kitchen, prepare something to eat. Okay, no worries. So there are some things that we do to protect someone. MGCSH, hi, just coming in, and that's a nice one. MG, what's your real name? MG 67 CZ8HE. Okay, now we talked about some complications that entail the Jason. Today we want to talk about antenatal care. Antenatal care given to mothers before they conceive. And there are some problems we talked about. We have discussed things like ADHD, attention deficit hyperactive disorder. We have talked about autism. Those are complications that are brought by when you are not taking care of someone antenatally well. The things that you're supposed to do when a person is pregnant or conceived, you are not doing them, and then a child comes out with complications, and even some mothers become big up to UMG. Yes, some mothers have problems because of poor antenatal preparation and care. Now that is what we will say as we wait for everyone to come in. You can see MG, Jason, Uncle here, and several that are coming in. Big up everyone. So do you know what antenatal care is? How can we define antenatal care? We can define antenatal care as this. Is the routine health care provided to a woman during pregnancy to ensure the health and well-being of both the mother and the child. It aims to detect, manage early problems earlier, provide health education and prepare the mother from childbirth and parenthood. You see that? Very important. It helps to prepare the mother for parenthood, and also eliminate some complications like autism. And I remember talking about how autism comes. You are a mother, you are not going to visit antenatal clinics, and as you are not going to visit antenatal clinics, there is this stage when the sperm and the overfuses, they form a zygote. So a zygote is a form of cells accumulated together. So they flow from the fallopian tubes, and then they are going to the uterus. You see, they form a ball of cells. This ball of cells are called, they have layers that are called mesoderm. I don't know if those diagrams that we drew that time, if we have them, let me check. Let me check if we still have them. The blastocyst. You remember the blastocyst? For those that are still going through embryology, blastocyst. So we have mesoderm, endoderm, and ectoderm. Those cells that are in a ball that are called mesoderm, endoderm, and ectoderm are the ones which becomes fuse. They go in and then they start forming a baby. You see, but if you are a mother, you are not going to antenatal clinic at this moment of the first trimester. You may, or you are taking alcohol or drugs. If you are taking alcohol or drugs, they can injure the cell itself, and when they injure the cell itself, you start having problems with your something. You start having problems with your child. So you get problems like autism. I'm finding that diagram. I don't know where I kept it. Let me find it. Let me find that diagram. Let me see if I have it here. So let's define ANC. We are still defining ANC. Dorothy, later you're trying it. We are still defining what antenatal clinic is. Look at your brain. This is your brain. The time we were talking about amygdala, neural tube development problems. We were drawing these things. You remember this? We were drawing these things. Neural tube development problems. Where is that diagram? I think it has been placed. So let's continue. Let's continue with what we have. I'm not getting that diagram. I'm not getting that diagram. Let's continue with what we have. So we continue and say that the objective of going to antenatal clinic, I repeat what ANC clinic is. It's a routine health provided to a woman during pregnancy to ensure the health and the well-being of the mother and the baby. Both of them, not the baby alone, because the mother can have problems like anemia and some others like infections and low immunity. So it ensures both the mother and the kid. It aims to detect and manage any problems earlier. If you start having anemia the first trimester, and we talked about types of anemia like microcytic anemia, megaloblastic anemia, all those, you detect them earlier. When a mother goes to ANC clinic, there are some objectives that must be met. There are some objectives that must be met, and these objectives are which ones? These objectives are monitor the health of the mother and the growing fetus. To monitor the health of the mother and the growing fetus. You see, it's very important to check out health of the mother and the growing fetus. Detect and prevent. These are the objectives. Detect and treat. Detect, prevent, and treat related complications earlier. We will see some of these complications, but some of them we dealt with them some early days, and I know some people know about them. There is another objective which is important: prevent maternal and newborn illness and death. Prevent maternal and newborn illness and death. Very important to prevent maternal and newborn illness and death. Promote health, nutrition, and lifestyle during pregnancy. Health and nutrition. Don't take this, don't take that. Like when you are pregnant, taking a lot of meat, beta carotene and retinol. Retinol may bring some problems, and it is a form of vitamin that is found on. It's a form of vitamin that is found on animal products. Animal products, you see. So if you are pregnant, you better do more of greens. You better do more of greens. You see, Now, there is something else here. These are the objectives. I'm just going through the objectives, and we have just started this topic. It's a wide topic. It will go for more than 2 weeks. Prepare the mother and the family for labor, delivery, breastfeeding, and newborn care. If you are here and you are a woman, you went to these clinics, you tell us what happened there. You are a lady and you've been to these clinics, you need to tell us what happened when you are to those clinics. You are given some supplements, you are given some drugs. Stans is here. Monday blessings. Yes, Stans blessings. I'm here going through the objective. Monitor the health of the mother and growing fetus. Detect and treat pregnancy related. Peace be upon you. That is Ahmed, Stan's Kitchen. Everyone who is coming in, be blessed, everyone. And done. Jamaican uncle is here. You've just been talking to him and he's okay. Now, we continue. If you are coming in, you are a new person, you tell us the church where you are from and which side you are chilling at. It's very important to know that one. Very important. Now, let me go through the objectives of antenatal care again for the mothers. The objectives of antenatal care. Antenatal care is a routine health provided to a woman, routine health check provided to a woman during pregnancy to ensure that the health of the well-being of the mother and the baby are okay. It aims to detect early problems. I can't understand. Oh, you do a translator on your screen. You do a translator. Dorothy, someone help Ahmed Chondria met Ahmed to get a translator on his screen. So here we talk about monitoring the mothers. This is Yes, let's continue. Monitor the health of the mother and growing fetus. Detect and prevent related complications early. Are you? No, I'm not still there. I'm back. Today, you see, I'm at work. I'm back. Prevent maternal and newborn illnesses and death. Promote healthy nutrition and lifestyle during pregnancy, and prepare the mother and the family for labor, delivery, breastfeeding, and newborn care. Yes, those are the objectives. But we have some components of antenatal care. Antenatal care, everyone understands. It's very important to go through this, because most of the people watch this are people that are childbearing. So the objectives are those ones: to monitor health of the mother and the fetus, detect and treat, prevent complications early, promote healthy nutrition and lifestyle during pregnancy, promote early nutrition, and you see, it's very important. Prepare the mother and family for labor, delivery, breastfeeding, and newborn care. That is very important. Those are the objectives of antenatal care. But now we have components of antenatal care. Components. What does it entail? What do when a lady is pregnant and is going to clinics? What do they do? What do they do? They do this. Regularly, I enjoyed your breakfast with tea, Dorothy, chapati. Okay. Regular checkups. They check the blood pressure, they check the fetal growth, check how the fetus is growing, and fetal heartbeat. At times the mother can be okay, but the fetus is suffering, and the heartbeat is high. So they check all this. They check the status of both fetus, the mother, the status of the fetus, the mother, the heartbeat, the blood pressure, and also for people that are living in the advanced countries, you can check very many things about the fetus. It depends with the kind of machines that you have. Amniotic fluid, the fluid that is carrying the baby, you check if it is enough or it is low, because it helps the baby to do many things. Medical history and physical examinations are done when a lady goes to ANC clinic, like identify risk factors and existing health conditions, because a mother can go to the clinic, but this mother is hypertensive. This mother needs special care. A mother can go to a clinic and this mother is diabetic. This mother needs special care because she can give birth to a baby who is microsomia. Microsomia is a big baby. Sometimes when a mother is diabetic, they can give birth to big babies, which are problematic. Infections when you are diabetic. So it's very important to physically medically take history and physically examine. And these are the components of antenatal care. Identify the risk factor and risky healthy conditions. You should check them. Check the mother if they have these problems. Laboratory tests. Blood group, hemoglobin, urine test. You have seen the mothers have done this test. Blood group, hemoglobin, urine test, blood sugars, screening for infections such as HIV. All of those are done. Screening for infections such as HIV, hepatitis B, and syphilis. Yes, Lipenga, welcome at Benjamin the White Guy and everyone. Welcome, Lipenga, welcome to the platform. So we are talking about antenatal care. Antenatal care is very important by detecting early complications and managing them. Those mothers that are in the village, most of them don't go to visit antenatal care. You see, these are the things that someone goes to a hospital and this person needs to be done. Ultrasound scans, assess fetal growth, development, and estimate gestational age. You estimate how the fetus is, because a fetus can be bigger than the age. For most mothers that are diabetic, they have fetus that are bigger than the age. You see, immunization, such as tetanus containing vaccine according to local guidelines. These are very important things that we should do. You see, health education, advice on exercise, hygiene, danger signs, birth preparedness, and breastfeeding. Those are the components of antenatal care for a lady when you have conceived and you are starting the journey of having a baby. You should have regular checkups, blood pressure, weight gain, fetal growth, and fetal heartbeat. Medical history and examination of some complication or existing health condition. Laboratory tests should be done. Blood grouping, because if you are we don't know your blood group, but maybe you come to the hospital and you want to give birth, and it is you will run to the theater and we need to give you blood. So we know your blood group. Hemoglobin. Now that you have a baby that is growing, your HB, is it levels, is it at capacity to give you more energy, oxygen, so that you continue compensating to the baby and yourself? It's very important. Urine test, when a mother is pregnant, the cervix is open. So this mother is prone to more diseases. This mother is prone to more infections. So we check the urine test. Check if everything is good. And in urine, what do we check? We check for infections, the leukocytes. We check for something that is called protein in urine. Because protein in urine, we call it proteinuria. It means that maybe high blood pressure is high and the kidney is suffering, and that is called end organ damage. So in women that are going to ANC, these are things. Blood sugars, are they good? Screening for infections such as HIV, syphilis, hepatitis B. You can have these problems and then they affect the baby. And when you are screened against HIV, and that is a special one, you need to go through some other things that are given. Ultrasound scans, checking the baby fetal growth, checking the baby, estimating the age. The ultrasound is very important when you go to ANC clinic. It's very important. So if you are here, let's learn. Ladies that are here and maybe you went through this, let's interact and let's know how you did it and how you went about it. And we'll talk about something that is called importance of going to these clinics. Nutritional support, iron, folic acid, calcium, and dietary counseling. Like just now I'm saying, there are some important things that you should know, like retinol, vitamins. There are some vitamins that are coming from the animal products that are called retinol. They are not good for you who is expectant at the first trimester. They may make you have neural tube development. They injure. Many mothers take care of prenatal care and forget antenatal care. They ignore the many signs that come after birth. That is very true. They ignore. They see you as much as you are okay. No need to go to the hospital until 2 weeks to get a baby. You estimate the dates by yourself. But you see, that is dangerous. And when we were talking about neural tube development problems, you remember folic acid, the work of folic acid. Folic acid helps you to create the DNAs of the baby. When the blastocysts, the cells accumulation are coming to implant to the uterus, and now they are transiting now to form the baby itself. You remember? This is where the folic acid is really needed, the first trimester. This is where the folic acid is really needed. Why? Because it helps now to form the baby's DNAs. And if you are not going to the clinic and you are not taking green leafy foods, you are not taking the supplements, what will happen? Problems. Some cells of the blastocyst or the endoderm and the ectoderm will not transist well. The DNA will be shattered, so you can give birth to a child who is not okay, like an autistic child or some problems. You can get a child who has something called cleft lip palate. You have seen those cleft lip palate. Deficiency of some things when you are carrying a baby. It's very important. Stan's Kitchen says many mothers take care of prenatal care and forget antenatal care. They ignore the many signs that come after birth. Yes, that is very true. They go for prenatal consultation because they want to take care of the fetus. Yes. So we have talked about ultrasound, immunization such as tetanus. The mother should be given tetanus because when you are giving birth, you are having a lot of exposure to bacteria, infections. So tetanus must be there according to the local guidelines. In our country, you have to get it, like I think 5 times, and the 5th one, when you get it, that one is for life. You don't get it again. But the first baby, second baby, third baby, you should get. You see, nutritional support, iron, folic acid, calcium supplement, and dietary counseling is important. Like just now, I'm counseling about about retinols and taking leafy foods to give you folic acid. And as you are taking leafy foods giving you folic acid, you have to be given another thing that is called folic tablets as supplements. We want children that are born with DNAs that are good, no neural tubes, you see. So you start going to these clinics. When you see someone, as someone asked me one thing, someone asked me, hey, when should I start going for ANC clinic? When should I start after I've conceived? Should I wait until I'm 3 months? I told that person you should go immediately. Go immediately, do an ultrasound. Make sure that your baby is okay since conception, and you grow to that spirit. You see, very important. Don't just wait until the days are near, or you are having signs and symptoms of some problems. That's why you want to. That's why you want to go and start having checkups. No, health education is very important. When you go there, you are advised what to do, you are advised what not to do. Which drugs should you not take? Like metronidazole, they are called teratogenics. Which drugs should you not take when you are pregnant? You see, when you go to those clinics, it's very important. So you people just conceive and they stay home. When you go, you continue with your routine. You eat meat as always. You forget. You even don't know they have retinoids. When you have some stomach problems as a mother, you go to over the counter. You are given metronidazole because it works, and then you don't know that drug is giving the baby problems. Which means can be the substitute of folic acid and iron, doctor, if you don't have money to buy the medicine. No, those ones you have to take them. But for iron, at times I say you should check, because if your HB is okay through the pregnancy, that one is okay. But the one that I really don't like people not to is folic acid. Folic acid is you have to. Something that is helping your DS. Imagine when you are having the first trimester, the 6 weeks, and then the neural tube is forming and it needs that folic acid, and you are not taking. You are saying, when you're pregnant, you have very many needs. The body has so many needs because now it is compensating you plus the baby. And when it is compensating and you are there, you are akonani so I'm coming. Now you are always saying that you want to go to that is the time when you really need first 6 weeks, because the blastocyst, the endoderm, the ectoderm, the cells are transisting, the cells are going inside, the cells are dividing. So I cannot that question, which meal can be substituted, that one I'll say no. Just take the drugs. In our country here, they are given for free. ANC, when you go there, some government hospitals, they will give you for free. I don't know about other countries. I'm asking for a layman understanding, asking the naturalized and so on. If you want folic acid, green leafy foods, even some iron you can get in green leafy foods. You see. But when you are pregnant, there is no substitute. As you eat the green leafy food, Stan's Kitchen, you need to take the drugs. Even if you are, because you are needing very many you have many nutritional needs. So if some people don't take and they are okay. So at times it's not good to bargain. Me, I usually say that's why our government made it. When you are in NC, you are given for free. because of, I think they saw the problems that were arising from very many mothers, and they said no, we need to pick up this. So those are, anyone else with any question? Anyone else with any question as I come? Just wait a minute, I check this. What? Yes, yes. I'm asking for layman's understanding of the natural items. Yes, that one I've said green leafy foods will help. Green leafy foods will really help, and I usually see you love green leafy foods. Recommended antenatal visits are very important, and these visits recommended by WHO, World Health Organization, are up to 12 weeks, 20 weeks, 26 weeks, 30 weeks, 36 weeks, 38 weeks, and 40 weeks. 12 weeks, the blastocyst has formed. Now it's migrated and the organs have started to form. The endoderm, ectoderm, they are fusing, and that is up to 12 weeks. They are formed now, the organs are starting. 20 weeks, they are forming. 26. So the first 1, 2, 3 weeks, the 12 weeks, 20 weeks, and 26 weeks are very important. That one visiting is very important. That's why I'm saying when you have conceived, it's important to just go to antenatal clinic. Once you realize you are pregnant, start. Let's talk about danger signs during pregnancy. But let me repeat the weeks you should. Up to 12 weeks, the first, 20 weeks, second, and then we have 26 weeks, we have 30 weeks, 34 weeks, 36 weeks, 38 weeks, and 40 weeks. Those are the schedules for you to go to antenatal. Okay, kids are making noise here. Now, danger signs during pregnancy that you should note. And this one should not take you to, you should have started, but you should see the danger signs that are coming. And most of the danger signs, you know them. You know them. Some women go to antenatal clinic when they have danger signs. You see, they go to antenatal clinic when they get danger signs. Now, severe vaginal bleeding, this is a danger sign. Mostly at the first trimester. As the first trimester, if you have severe bleeding, a woman, you should rush to a hospital. Bleeding that is severe and it is painful. And then we have severe abdominal. Doctor, did you want to say prenatal or antenatal? Antenatal. We are talking about antenatal. We are talking about antenatal before giving birth, before delivering. Before delivering, that is called antenatal. So, when you have severe abdominal pain, you should visit the hospital. Severe headache or blurred vision. Sometimes your BPs can go high and you're pregnant, and then you start having severe blurred vision. You're not seeing okay. Swelling of the face and the hand. Yes, you know, some people when they have problems like proteinuria, the kidney is suffering because pressures have gone high. You start having swelling of the face, the hands, the legs, and sometimes you can have infections. I've said when a woman is pregnant, the cervix always is open sometimes, and most infections you can get them late. You start having sepsis, you start having convulsions because of high pressures, so high blood pressure. So when you're having these pressures high, Mr. Benjamin and Deborah in the chat, Fiona, hi, welcome. I can see you there, Fiona. Yes. Now, when you have convulsions, it's a danger sign. You remember you are holding a life. It is compensating for something. These are things that should take you to hospital. Fever, infections. If you are having infections, convulsions in pregnancy is very bad. Convulsions in pregnancy is very bad. Why? Because if you convulse and you are pregnant, it may bring the problem to the body. Hello, Dr. Ben and everyone. Welcome, Magic. We're talking about antenatal clinics and why it is very important to visit antenatal clinics. Why is it very important for you to visit the ANC clinic? Convulsions, fevers, reduced or fetal movements. Reduced fetal movements after 28 weeks. You should check if you have fetal movements. Leaking of fluids from the vagina before labor. Leaking of fluids. You may be leaking amniotic fluid that cushions the baby. So it's important you go and do an ultrasound. So danger signs, here we have talked about the danger signs that are severe vaginal bleeding, severe abdominal pain, severe headache or blood vision, swelling of the face and hands, convulsions, fever, and reduced or absent fetal movement after 28 days, and leaking of fluids. You eat blood, fluid. Blood is a fluid. Clear blood, amniotic fluid is a fluid. Infections can bring fluids. So any type of fluid that you are, it's leaking from down there, check the hello fam here watching in background. Oh, J Hug, welcome J Hug. You should check and go to the doctor to get the solution. Those are danger signs. Headaches, severe headaches and blood vision. Don't take it as normal. I'm used to it. You are swelling your feet, and then you say, even my mom, when she told me when she was pregnant, she was swelling the feet. No, check the doctor. Can I repeat the danger signs? Let me repeat the danger signs because they are important. Okay? Severe vaginal bleeding, severe abdominal pain, severe headache or blood vision, swelling of the face and hands, convulsions, fever, reduced or absent fetal movements after 28 weeks, and leak of fluids from the vagina. Very important. Fluids. I've said fluids can be blood, it can be amniotic fluid. Amniotic fluid is the fluid that carries the baby. It has very important things that it entails. Very important. So you as you prepare to get a child, these are the danger signs you will be checking on. Let's talk on the detects pregnancy complications early. These are important. Let's talk about the importance. Tomorrow we'll start going step by step about ANC, antenatal clinic. Today I'm just giving an overview. It entails so many things. So many things. When we come to weight, we will check what about the weight of the mother in relation to the weight of the baby. What about the very many things. Nutritional care. What should you take? What should you not take? The other thing we will talk about is what drugs should you take and which drugs should you not take. You see, very many important things we'll talk about. Let's talk about importance of ANC. importance of ANC. If you have any questions or something you want to say, please let it in the chat. Let's discuss what you have. Now, detects pregnancy complications early, such as high blood pressure, anemia, diabetes, and infections. No alcohol. Yes, no alcohol. Alcohol interferes with some cells and it interferes with the liver. So you may bring up a baby that is having problems. That we will discuss. We will discuss about them. No alcohol. But when you go to ANC earlier, it detects pregnancy complications early, such as high blood pressure, anemia, and diabetes and infections. Very important. Helps estimate the expected date of delivery and monitor the growth of the child. The expected date of delivery, so that you can plan yourself. You just don't, you're there and you kind of like you don't know when things happen. You go to the hospital, you don't have even something that can hold the baby, Help estimate the expected date of delivery, very important. Identify high-risk pregnancy that may need special care or delivery in higher level facilities, like a child who is growing in the womb and has a knuckle cord. Those are children that are not supposed to be born on some dispensary somewhere or at home. They need to be taken good care of. A mother who is having preeclampsia. Mother who is having preeclampsia is high blood pressure. That is a mother that is supposed to be taken care of at hospital, a level 5 hospital, and very many things. A seroreactive mother, a mother who is HIV positive. Those are mothers that should be taken care of in a hospital. Screen for anemia and provide iron and folic acid supplements. The supplements are very important. You see, those ones sometimes you don't miss them. You see, greetings to everyone over here. I'm here to something to eat. Okay, that is Uncle saying you love you all. I'll connect with you after this live, my JB and Fiona. Yes, thank you, teacher, to do that. Now, let's talk about tests for infections such as HIV, syphilis, hepatitis B, and urinary tract infections. These infections can bring more problems that you cannot know. Syphilis can destroy your baby's normal growth. It can give you more problems. It can give you psychosis. You've seen people that have syphilis and they have become psychotic. Syphilis, and then it has destroyed the baby, and you give birth a baby with defects. Very important. Urinary tract infections. You'll get kidney issues because if you don't treat them early and you are here having a baby, compensating for nutritional care, compensating for you'll have problems. The baby may suffer. Hepatitis B, which is a very common complication. I've seen some women when they are pregnant, getting hepatitis B, being sick, fevers every time, yellow eyes, because hepatitis B affects the liver. And you see some things come from the liver, some blood supply, because there is a hepatic vein that comes from the liver, and it goes directly to the knuckle cord to the baby, and it serves the baby with oxygen. And here you have hepatitis B. Very important you go to be checked so that you can support prevention of mother-to-child transmission of HIV. Because those people that are seroreactive, they have low immunity, they have a place that they go to a hospital, and then they are checked and they are watched closely by doing the required tests like serum crack, like another one that is called CDF, CDF, CD4 count, CD4 count, so that they can be treated and managed well as you continue. Provide tetanus vaccination to protect the mother and the newborn from tetanus. The mother and the newborn. And I've said you are given 5. After the 5th one, you are not given again. That one is for life. Tetanus. Monitors blood pressure and urine to detect preeclampsia early. Eclampsia only means you can get, when we say eclampsia or preeclampsia, it means you can get convulsions because of high blood pressure, and those ones, convulsion can cause the baby to be born with defects or the mother to have a stroke when you are pregnant. So preeclampsia is high blood pressure. Eclampsia, it is the convulsions themselves when they have come. So monitor blood pressure to prevent or detect preeclampsia. So how do we know this mother can have preeclampsia or eclampsia? When you are taking your blood pressure is taken, and urine is taken, and then we find your urine has proteins. We know the kidney is suffering and you have high blood pressure. So this one is, we term it as preeclampsia. It can be fatal very soon. So we manage, we bring down the high blood pressure by using tocolytics like magnesium sulfate, and then we monitor you so that the baby can be safe. Now let's talk about giving nutritional counseling for health maternal mothers, gain, weight gain, and fetal development. Nutrition, we have said, it is very important for mothers that are pregnant. Always you should be doing green leafy foods, supplements, calcium, do some good protein, not overdo some protein that have a vitamin that is called carotene, because it may damage the growing baby. You see, those are the important points that we have when it comes to give nutrition counseling or health matters, weight gain and development. Nutrition. Hungry or or tired? Now it's being hungry or tired. Educates mother on danger signs such as vaginal bleeding, severe headaches. Those danger signs, we have talked about them. Just a minute, I come. Yes, let's continue. We said Garja. Hi, brother. This is Garja Sahanau. Garja Sahna. Okay, that name is hard. Give me a simple name that I can call you. I saw you texted me. I replied it. Garja Sahana. Now we are talking about antenatal care and antenatal. Thanks, Garja. Antenatal care is very important. When you go to antenatal care, welcome, thanks. What you have done is you are given education about danger signs. India, from India. Okay, nice one. Welcome to the platform. Now, weight gain, severe vaginal bleeding, severe headaches, swelling of the feet, fever, reduced fetal movement and convulsion. Sometimes the fetus cannot be having movement and having convulsions is a danger sign. So these are the things that are educated when you go to antenatal clinics. You were given some health talks. You were given some health talks. No. Promote safe birth planning. Include choosing a health facility and skilled attendant that will. Some people are even asked, do you need a gynecologist on your side? According to your pocket. That one, some years ago, that one was not there. But nowadays, I can see some people saying, I need a gynecologist. But the other attendants are also okay, unless you have a specific complication that is making you have these problems. You see, choosing a health facility is important because nowadays we have insurance policies and these health facilities. Okay, David Diaries, I see you. Yes, David Diaries, Efasi Garjasa from India for things like Dan Brother. Thank you for everyone who is watching. We are talking about something that is called antenatal care. A mother who is pregnant. Devi Garja, Marjay, Stan's Kitchen, Jay Hank, Fiona, Dorothy K, Ahmed, Jamaican Uncle, MG, Jason, everyone who is watching and is here. Thank you so much for being here and your support is being and your support, my friends. Thank you so much for everything, for being here. These are important topics that we are talking about. These are important, very important topics. What I want you to do is, as you watch, share it with your sister, share it with your brother. Let's interact. You see, yeah, my sister is here. God bless you for coming, David Harris. Hi, righteous sister. How are you? And if you have a question, any medical question, and you want help, don't hesitate to talk. Don't hesitate to talk. You just text me on one of the videos and let's share the information. You know, sharing information is empowering each other, and that's what I'm doing. I'm empowering everyone to have the information, to grow, to know what to do when there is this and that problem. Let's share the information, my friends. Let's get to share. Let's share this information, you know. And here we have good people, very nice people like Jamaican Uncle and Stan's Kitchen. Visit Stan's Kitchen for good nutritional cooks. Subscribe to each other. Let's have that community that grows, you know. Yes. Let's engage in helping each other. Happy birthday to your princess dogs. Dog. Hugs and kisses to her. Yeah, I've posted her. Please view that video. See how she's excited. I was with her to the village. I was with my princess to the village. And now she's at school. I had to give a cake. Welcome. Thanks for that acknowledgement. David, happy birthday. No, not me. Marjay, tell David Harris whose birthday it is. It's not mine, but hers. As you can check the picture there. Okay. Now, okay. Thanks for that acknowledgement. and everything. Yes. Makes me feel smile when you see them grow and you see them doing well, progressing. Years come, years go. They call you dad. You feel nice, Yes, you feel better. Yes, I saw but happy birthday to your daughter. Yes, Tans, I saw you commented, these are our children, and when they grow healthy as a father, I feel nice when they call me dad, when they request me, I want a birthday cake. I want to celebrate with my friends at school. They say, yes, I'll send a birthday cake at your school. And then it goes and I see the videos. We are proud of our children, yes? Let's pray for our children to grow with discipline, with God's favor. Thank you for everyone for your acknowledgements. Thank you so much. She calls herself Dad's favorite daughter. Dad's favorite daughter. Where everywhere I go, she's there. Even if she could be in hospital, I know she could be coming here in office. Okay, and let's continue about antenatal care and the good things about antenatal care. Birthday B, convey your daughter happy birthday, Princess. God bless you, dear. Yes. You can check the shot and at the post. I've posted the cake, and she's there, feeling excited in class as they eat the cake. Educate. Let's continue with antenatal. Happy birthday to your little one. Thank you. India time 8:30 p.m. brother. Here it is 5:58. Yeah, imagine it is 5:58 p.m. Yeah, and we are just talking. Yes, I think Devi have subscribed to everyone. Everyone that is here, I usually support. So if you are here and you are my friend, text, you will get more subscription here, because there are some people even watch my talks and they have not subscribed, and they subscribe to other people, and I feel good, and I feel nice, because let me tell you one thing about medical talks. Many people don't like to know about diseases unless they are sick. Happy birthday to my little friend. Yes. Your little friend was excited. Hope Jamaican uncle, you have seen that video as she's in class excited with the friends. I've posted it. Check it out. You see. So when people come to my channel and they see someone like Stan's Kitchen and they follow, they see, oh, this is food. That is where they like. So my channel is a portal for many people growing. Yes, So let's interact. Let's continue interacting. The third truth, doctor. Yes, people don't like medical talks. Let me tell you the truth. They only come here. Most of them come here when they are searching. They want to know about a solution that they are undergoing or someone else is undergoing. You see. But here, as we are here, we are friends and we are growing. You see. So let's continue. Let's continue talking. Let's continue interacting. Let's continue interacting. Now, what are the advantages of ANC visits? Help families prepare for transport, food, blood donors, and emergency contacts before labor begins. Those are things that when you are told your son has low HB and she may need blood when giving birth, you start preparing early. You start preparing early. You see, provide malaria prevention measures in endemic area, including intermittent preventive treatment and insecticide treatment. Very important things, my friend. You see, these people have not brought my green tea. I feel bad. Let me tell them to bring my green tea. Yes, my green tea is coming. Thank you so much for being here, my friend. You are greatest of all times. My friends are greatest of all times. As we enjoy, as we discuss these things, I feel nice. And we continue having blessings all through. Blessings. So, detect abnormal fetal position, multiple pregnancy or poor fetal growth. Eh? Provide counseling on safe medicine and avoiding harmful substances during pregnancy. Harmful substances include the drugs that you take, medication, and some people buy. They may send someone, you go to the pharmacy, brother. I'm a new subscriber. Oh, David Diary, welcome. I can see Stansky knows you. Welcome to the platform, my friend. David Diary, welcome to this platform. And I may say, not even the platform, welcome to good friendship. We are here, we know drama. Here we love empowering, giving messages and giving information and feeling and interaction. So, David Diary, welcome. If anyone is here who is new to my channel and you are watching, don't fail to subscribe so that you can get a notification. Benjamin the Wise Guy is online. What are you waiting? Go and watch Benjamin the Wise Guy. So, are you new? If you are new and you are watching, come to the chat, tell us you are new, where you are watching from. So, welcome, David Diary. Thanks. I wish it could be on Friday. We could welcome you in a good way. So, wait for a Friday. Just wait for a Friday. At the same time, you will like it. Fridays are good days. We do good things here. And many people come here on Friday, and we feel nice. Now, let's continue with the talk now. Detect abnormal fetal position, multiple pregnancy, or poor fetal growth. You may have twins, triplets, quadruplets, all those. As much fetus you have in your stomach, the more care you need, the more good care you do what you need. So you may have this, and you may need this help, nutritional supplement. A mother who has one fetus then does not need much as the mother who has 2 or 3 fetus. These are things that you should go. Go to the clinic, be counseled about this medicine. You will not take it when you're pregnant. This medicine, you will not take it when you are, the first trimester. Welcome, my friends. I can see many people watching and they are not telling us. Come to the chat, my friends. Tell us where you are watching from. Tell us. We love friends. We love friends. We love new friends. We love new friends. Screen for mental health concerns and provide support for referral when needed. There are some mothers who get pregnant when they are not prepared. The mothers that get pregnant when they are not prepared, and one thing that hits you on the head is, how will I provide? How will I provide? So you go to ANC clinic, you meet there women, some good ladies, they start to talk to you, they tell you this is a nice journey, don't worry yourself, God is there, everything will be okay. And you have seen some mothers when they are after they have given birth, they get psychosis because of lack of preparation. Some mothers, they get babies and they don't want the baby. They start behaving like he has a mental health issue. It is because the preparation, or this mother did not go for antenatal clinic preparation. So for us to be, for our mothers to be stable, our mothers to have the stability of mental health, our mothers to have the stability of not getting into depression when they are carrying a baby or when they have given birth, what should we do? We should give them counseling. And not even the first mothers, a mother who has never got a baby, most of them are depressed. It is stressful. How will it be when it is labor? when the labor comes, how do a person feel? Because they are told that it is painful, painful. So you start having it's the first time for being a mother. It is, these are things that we should check on. These are things that we should check on, and these are things that we should relate on, and these are things that we should be following up. ANC Clinic. Today I'm just doing an overview. An overview meaning I'm just going through some 1, 2, 3 things. 1, 2, 3 things that we may be talking about. You see, as we continue. So, another thing is it offers health education of hygiene, rest, exercise, breastfeeding, and newborn care. Newborn care. How to take care of your child prior to delivery. Strengthens the link between the mother, family, community, and health facility for continued care. The link. See, reduce maternal illness, maternal deaths, prematurity, and newborn death through regular monitoring of the mother and the baby. See, all these things, I've talked about more than 20 things. Skilled delivery, risk of maternal and newborn complications. T is here. So T beauty, this is very important topic for you. Very important because it is coming today. And thank you for coming in even when you are just about to end. Okay, brother, bye. Sorry, urgent phone call. No problem, no problem. David Harris, thank you for being a friend. T Beauty, how are you feeling today? Today I'm talking about our mothers. Today I'm talking about our mothers. Our beautiful mothers and our beautiful mothers to be like I know you love children. Maybe one day you will have some. And this topic is very important for a person who is a mother to be. A mother to be, a mother that is coming in future. So these are things we should check on. These are things that we should. These are things that we should. Today I'm feeling great. Oh, nice. I feel nice when people are feeling great. I think before I finish, I should go through the importance of antenatal care. Yes, I love kids. Yes, I know. T Beauty loves kids. People with big heart, they are emotionally so attached. They are high when they are attached to something. And they love what God loves more, kids. You see, so there are people that are, blessings. When you see people that kids love, when that person like Maro, you have seen when Maro is at home, kids are in the compound from right, left, and center. That is a good person because closer to God is closer to kids. So let's continue and be loving to our mothers and our mothers that are coming to be. Like T Beauty one day will be a mother and we will love it and we will. You see how I am attached to my daughter. Like you have seen the birthday. T, you should look at the birthday of my firstborn. I've posted it there, but it was school day, so it has to be done in school. And she was feeling excited. Telling me, Daddy, I'm cutting the cake right now. Imagine you are at work and your kid is saying, thanks for bringing the cake. I am cutting the cake right now with my friends. How do you feel as a parent? How do you feel? How do you feel as a parent, man? God has a way to make you smile. Even if things are, Marwa has more than an empire of kids. Wow, he's such a great person. The cake is lovely. Thank you, Marje B. Thank you. Yes, if you see a person, kids loving a person, just know that that person is God sent to the world. There are some people, even if you leave kids with them, they'll be crying all through. And if that person is around, you will never see the kids around. You just have question marks. So these are the importance of ANC clinic. The importance of ANC clinic detects pregnancy complications early, such as high blood pressure, diabetes, and infections. Helps estimate the expected date of delivery and monitor fetal growth for future planning. Not to be you are delivering, even the kid does not have any clothes. I know of Moses who is like a walking stick of Marwa. Yes, always there. Yeah, always there. Identify high risk pregnancy that may need specialist care or delivery at a higher level facility. Yes, high risk pregnancy like knuckle cord, preeclampsia, all those complications. Bad lie like someone is not, the baby is not lying cephalic, is longitudinal, should be delivered in high facility. Like in Kenya we have levels, level 2, 3, 4, 5. So they have to go to level 5 up to 6, 7. Screening for anemia provides iron and folic. Supplements, giving supplements to the ones that need them. Tests for HIV, syphilis, hepatitis B, and urinary tract infection. Marwa wants 10 kids. Yes, God provides, and that is his wish. Let God give him his wish. We are very soon will be seeing someone somewhere. He calls it potential. Yes, let's wait and see the potential, my friends. Monitoring blood pressure and urine to detect preeclampsia. I've explained that. Give nutritional counseling for the health, maternal weight gain, and fetal development. I've talked about weight and fetal development. Educate mothers on danger signs like vaginal bleeding, severe headache, swelling, fever, reduced fetal movement, and convulsions. You see, very important. Promote safe birth plan, including choosing a facility and skilled attendant. You see these things, my friend. You see, promote safe birth planning, including choosing a facility where skilled birth attendants are. What happens for someone to have a breech or sometimes ectopic pregnancy? Ectopic pregnancy is when you are taking, before pregnancy, can woman take folic acid? Yes, even a man can take folic acid. It helps to create the DNS. It is important. When you are preparing to get a child, you can start having the folic acid and take green leafy foods. So Stan's Kitchen is asking, what happens for someone to have a breech and or sometimes ectopic pregnancy? You are taking family planning pills that are very concentrated, like the ectopic pregnancy is in the tube. Yes. So we talked about it a day, an ectopic pregnancy on complications. When you take the postnatal emergency pill, you have just had sex and you are taking it, and you have, traveling from the follicles to the fallopian tube to implantation may take 6 days, and then you are taking after 72 hours and it has already flowed. So it makes the components, the fluids at the vagina, the uterus, and the pipe, the fallopian tube, to be thick, and then your zygote cannot flow to go and implant it. It is blocked. It starts to grow at the fallopian tube. So one of the things that are muchly here that supports ectopic pregnancy is this thing that is called emergency. Yes, emergency pills. Emergency pills. Oh, my green tea is here. You see, so I think that is what you are asking about, ectopic pregnancy. So that is one of the common, because many people nowadays use them. They use family planning. There is highly concentrated progesterone and is level nostrogen. So they make the fluids around to be very thick, and then the zygote cannot come and be implanted. Sometimes you can have some complications, and these complications are fallopian tubes that are so small even the zygote cannot flow. The tubes that look like this, they cannot flow. So when you have these complications, what happens? What happens is you have ectopic I see potential for bromaro. Yes, which potential for bromaro? Tell me. I hope you are not saying T beauty. I hope you are not saying T beauty. T beauty. T beauty. I can see J Hank. Oh, T beauty. I see potential for T beauty. Tell me that ain't no wrong. J Hank is saying I see T beauty potential for bromaro. T beauty, you should come to Kenya, man. You should come to Kenya, my friend. My green tea is here. If T beauty is for bromaro, I second it. I'll feel good when they're looking in their eyes, dancing to a reggae song. T beauty, I will sing for you. I feel good when you're rocking with my bro, dancing with a reggae song. So I'm waiting for that moment. Jai Hank, if it is it, if God has said it, let's do it, my friend. No hara, no wahala, man. Let's do it. Marwa is my bigger friend, is my bro, and I am happy for him when he's fine and he's smiling, So let's do that, T Beauty. If it is true, thank God, man. Thank God, because I want T Beauty to be married in Kenya, T Beauty, I said, a Kenyan boyfriend, Me too, I feel good. I will sing for you that song. I feel good and you're rocking with my bro, dancing to a reggae song, So Jay Hank, thanks for you telling me T Beauty that, right? Because I usually tell T Beauty to get a Kenyan boyfriend. Let it be Marwa. She's already a subscriber to a Marwa channel, so I support 100%. I do support, even me, I support Stan's Kitchen 100%. And I'll be in that wedding, there, dancing like hey, and feeling nice. So, T Beauty, man, I hope this dream, this prayer that we have, let's say a prayer of sincerity and love to our friend T Beauty and Marwa himself. I wish it comes true, man. I wish it comes true. As I sip my green tea, it has antioxidants. It is making me feel healthy and getting nutritional demand. You see, my friends are good people. You guys stop it. No, how can we stop it and we want you to be happy? Just imagine being around the travel commando and the way he's a good person, the way people love him, the way he knows how to laugh. Let me take another sip of my green tea to rejuvenate that point. Thank you so much, Jay Hank, for that point. My green tea, please come slowly. Yes. Jay Hank, yes. Why have I been sleeping so much on this? My eyes was sleeping. But thank you, Jay Hank, for opening my eyes. I'll start giving my friends some vibes. I'll start T-Beauty. You are always made me laugh. Thank you, Jay Han. I start giving my bro some insights. Bro, hey, I'm not seeing this thing. That is how we do things. And then T Beauty, after some time, he'll be in Kenya smiling. Hey, this is so nice, man. I didn't see that coming. Jamaican uncle, where are you hiding? Come and see this. Yes, even thank you so much. Thank you so much. And I'll text him today and tell him, hey, today there was a hot topic on my platform. Please check it out. Hey, I will tell him. Please check it out and potential. Amaro is a funny guy. I love him, but I love him because of his hard work and resilience, and the way he pushes things, and the way he helps and never stops. Even if you do what, he's there helping. Even if you cry, Maro will always help. Even if you do what, he'll always say, I'm here to help my people. And as you see, most of the people are eating because of him. Even the negative reactors, they're making money because of his name. And God is providing for him big time. So let's always pray for him to have a good life, a healthy life, and a good wife. Hey, Benjamin the wise guy, today you're talking about your brother in another way. Hank, you. Thank you for that. I didn't see this coming, but you've opened my eyes. You T-Beauty. You said you cannot say that, but you should sing for him one day. You got my eyes when you walk towards my pathways. I could turn away, my eyes led me. I thought I was dreaming, but you looked right in my way. And all my eyes could see, it's you. If it is love, my dear, welcome to my world. Hey, T-Beauty, listen to that. And let us share the good times together. It's only one world, let's share it together. Cause all my eyes can see, it's you, my dear. Hey, no Masana, Leila is here watching from United of Ngong. Leila, this discussion is hot on fire. If I get someone, it can be a lazy man. It can't be a lazy man. And I'm giving you some tune here to sing for the commando man. Might say that is 100% true. I don't follow the hype. You know what I mean? Yeah, you don't follow the hype, man. T-Beauty, you are always on track, and I know you are a lady of class and discipline. A lady of class and discipline you are. So hit up. And if that one, what Jay Hank has said comes to be true, then I'll pray for you. I'll pray for you guys, life to become so good, But I've sung for you that song. You give it to the person you love. I don't know if you know the tune, the person who gave the tune. Judy Bocha. You got my eyes when you walk towards my pathways. I could turn away, my eyes led me. I thought I was dreaming, but you looked right in my way. And all my eyes could see, it's you. If it is love, my dear, welcome to my world. If it is love, welcome to my world. And then let us share the good times together. Tea Beauty, that is your dedication. Don't fail to sing it to the travel commando when time comes. Hmm? The vibes are flowing. I like the chat of today. Where is Jamaican uncle hiding? Jamaican uncle, come and listen to this. Come and listen to this vibe, Jamaican uncle, my friend. Reduce. We were talking about advantages of going to ANC earlier, and we have reduced mental illnesses, maternal death, stillbirth, premature birth, and newborn death through regular monitoring and timely treatment. Screen for mental health concern and provide support for referral when needed. Very important. Strengthen the link between mother, family, community, and health facility continued care. So today I've given an overview of something that is called antenatal clinic, and you appreciate it is just an overview. So we will give something that is very important. After this, we will start to go step by step about antenatal care, because people are saying you have forgot our women problems, and now I'm talking about our women. Our women are here and they need much love. They need much love. Celine Dion, someone just popped out a song about Celine Dion, and I've just been singing about Judy Water. The coffee cakes loving bitch. Hey, I hope you have been following Coffee Cakes about the good things that I'm seeing on the platform. Coffee Cakes is here, my friends. Let's welcome Coffee Cakes. Hey, Coffee Cakes, how are you doing, my sister? How are you doing, my friend? Hope you are doing good. Anyone who knows any tune of Celine Dion? Anyone with any good tune of Celine Dion that, Celine Dion was a hit maker. That lady was giving some hit to hit. Some good hits, my friend. I'm alive. Any other that you know about Celine Dion? Any other that you know about Celine Dion? Any other vibe about Celine Dion? Let me check. I can read your mind and know your story. I gotta know what is true. Yeah, it's an uphill task. Power, native, love. Although Air Supply wrote it, Celine sings it. Good. Let me get power of hey. That song, my friend, hey, 'cause I'm your lady and you are my man, and say wherever you reach for me, I'll do whatever can. Been waiting for so long. Every night in my dreams, man. Who is there every night in your dreams? Tea Beauty. Who is there? Tell me who is there every night in your dreams. But for Celine Dion, let me tell you one thing, my friends. For Celine Dion, Power of Love was a hit. Power of Love. Even right now, if you sing for your person, Power of Love, that person can build you a mansion, can give you everything. Can give you everything. 'Cause we are headed to somewhere I've never been. We are headed for secret. Whoever I said good night to before I sleep. Who is that Tea Beauty? Who is that? Who is that Tea Beauty, man? Tea Beauty. Yeah, who did you say good night to before you sleep? Let me do this first. Let me do this, let me do this. Because that song that someone has said, that song, man, that song, it reminds me something that is very special, very special. This one reminds me of a very special thing. Still the power of love. You fall in love and you get hurt. Let me play this one. This one is for you guys. You make me start teaching and then we become, we do some other things. Play every night in my dreams. Every night in my dreams, man. But Beauty, who's every night in your dreams? Just give us a hint. Who is every night in your dreams? Give us every night. Will go on for tea. My heart will go on. That song, man. I watched the Titanic, and that song was dedicated in the Titanic. Who has watched Titanic? What a live stream today. Today is that live stream of lovey-dovey affairs. Listen, and it went on, and then Celine said, say it again, Selena. Wherever you are. Wherever you are. I believe that my heart will go on. There is a love is beautiful thing, man. Love is beautiful thing. And you guys, you want to make me continue to falling in love and do it. You fall in love, you know you'll get hurt. Your spine will break. There is one here. Let me see. Every night in my dreams. Hey. That is for every night in my dreams. Celine Dion, my friend. Yeah, sometimes love makes people do some things that are not good. Yeah. Who has ever watched Titanic? If you have, your brain will stop, lol. Ask Aki Monday. Imagine, in a Monday, let's start the week in a good way, my people. We started by but it's funny, we started about our beautiful mothers bringing life, conception, antenatal clinic, and now we are ending with some good vibes, like good love songs. J Hank started it. J Hank started it, and now we are continuing with I love you all, but I have to go, my beautiful people. When love, it is it's about 7. Wow, my friends, it's about 7. I even forgot. It's about 7 now. These good vibes makes the concept. These good vibes makes the conception. You get a baby having good vibes, and making love is bringing out life. I think God is a you make love, you bring life. Yes, just imagine that. Yeah, and these good vibes bring it on top. So if you are watching me today, we have done antenatal care, and I want to ask anyone with a question, please bring it up. Anyone who has a question, my friends. The good vibes are here. People have felt good, people have felt nice. So any question that anyone has, let's get to know it. Who has a question today? Who has any question that is pressing, any question that is inside, any question that is stands take care. Anyone with any question, So we have started the topic of antenatal care, and we will continue with our good mothers this time round. Continue with good topics. We'll continue studying these good topics. Being 24 and having started life yet with a man is funny. I just be wondering of the unknown. Let me focus on school now. Hey, school for now. You don't have a boyfriend? Hey, I see what J Hank was watching on. I see why J Hank was on you. Yes, finish school, create your career. A good man comes after that, you know. But there are some people like us, we just started these things after college, and we stayed and we married and we are there till now, and God is blessing us with more kids and more life, and we love it, you know. I have a boyfriend. Oh, a Kenyan one. Okay, now if it's a Kenyan one, that is good. That is very nice. That is very kudos. When you are not looking. Always happens when you are not looking. Yes, some things happen when, like many people get married, they never know the time that they'll get married. You say, kind of like say next year I'm getting married, and you find out that you're getting married even before next year. You say now, you know, I'll be married I'll be married after 3 years, and you've stayed for 5 years, you have not got married. Oh, you are 24 T Beauty. I wish you the best with your positive attitude. Keep it up. Yes, keep it up. Keep it up, my friend T Beauty. Keep it up. We are older than you, and we embrace your good character. We love it when you are doing that. I honestly was just minding my business. Yes, but when you are a friend to me, don't just mind your business. Let me get into your business a bit. You hear me, T Beauty? When you are my friend, let me meddle in your business a bit. Hello, Doc, and everyone else. Muriet. Today we started talking about ANC clinic, and you know what popped out? J-Ang, like boom, this is the bomb, and now it turned the whole thing into some good vibes. It turned everything in some good vibes. So my friends, love is a beautiful thing, but I always say don't fall in love. Know someone first. Someone first, and then everything will come. We don't want heartbreaks. I don't love Dr. Benjamin. She's now my daughter-in-law. Oh, let me enjoy la land for now. Hey, no Mazara, no double tap your screen. The doctor is funny. I have a sister who is called Fanny. I don't know why. One day I'll bring my sister here. Good advice for me. But one day I'll bring my sister here. You will laugh, all of you. She's funny but tough. Good advice. You don't fall in love. You get to know someone first. You fall in love and then you hurt yourself. And you don't fall in love.
Llevaba días con esta melodía en mi cabeza.
Yes. Muriet, nowadays people are funny. You fall in love with someone has his own things that he's planning. And then when that person has done with you, he goes. So don't fall in love first. You'll hurt yourself if you fall in love. Gradually get in love. This idea, you gradually get in love. This idea of falling in love, I mean love. You're using your finances, treating someone, and then when you are broke, the person runs away. No, we don't want that. You have to get in love gradually as you understand that person. True, you'll jump up right without using your brains and know what you are getting into. Yes, heartbreaks. And then, you know, when someone is left, But when you are in love, you are bragging that we are in love. You show it on social media. When you are left, shame comes upon you. Shame, because you are bragging. Now Celine Dion wants to kill me with love. Listen. Because I'm your what? Listen. Hey, I wish my wife sings for me this tonight. Listen. Listen for me. Listen. Hey, come again. Wherever you reach for me. Hey, when I was dating those days before we fell in love and got in love. Just listen, my friends. Who doesn't want to be told these words? And you are my man at wherever you need yes, for me, I will do anything that you want. Listen, my friend. Hey, you are a stupid guy when you do anything that someone wants and you are in love. To me, kill, use your brain. But here Celine Dion was bluffing with us. That I'm your lady and you are my man. And then you fall in love, you do everything. You'll break your legs. Power of love. Do you know what love is? Look at someone, it gets to your brain, it confuses your brain, and you become somehow mentally unstable. And that's why you do those things that you do when you are in love. You become somehow mentally unstable. Hey, mentally unstable people in love, listen. Mentally unstable people, when you are in love, you don't think straight. You start telling people that, you know what, I think Celine Dion was in love too much. Celine Dion, you were in love too much. Let me see. Tell them what you are telling people. Listen. You have just seen someone and then you start telling people a new day has come. How? No new day. Remember, your own choice will make you happy or kill all your dreams, because this is the person who will be in your dreams forever. Even if it's an ugly Jojo, even if it's a beautiful one that had breaked you, you'll never forget this person. So fall in love or don't fall in love. Get gradually in love as you learn some people. I can read your mind and I know your story. Hey, you can read my mind. Some of the people here are what? Hey, let me not say that once. My heart will go on. So, guys, thank you so much for tuning in and making me remember these days. There is this song of From This Moment, Shania Twain. Shania Twain. There is a song that I usually Shania Twain. Yeah, Shania Twain made me fall in love again, and Shania Twain really, Shania Twain really made my, I can't say my childhood when I'm becoming a man. I am Josh Benjamin. Greetings. Listen to what Shania Twain wants to say. it looks like you made it. Listen, look how far we have come.
Look how far we've come, my baby. We might have took a long way.
Yes, now this is the song that you should be singing to your man. Listen.
We knew we'd get there someday. They said, I bet they'll never make it. But just look at us holding on.
We're still together, still going strong.
Still going
strong. Tell them Shania Twain.
Still the one.
Falling in love gradually. You are getting in love gradually. You are not falling in love. No, this is the song, you know. This is the song.
Still the one I run to.
You are still there even after 20 years, 10 years, 5 years.
The one that I belong.
You're the one that you belong to. Another thing.
You're still the one
I get for life. What do you say? You're still the one. Even after you go pocketless from this moment. Even when you go pocket without nothing, that person is still there taking care of you. Even if you hurt yourself and you start using scratches, this person is still there. No, these are the songs, you know. Shania Twain was that person. Now, Copycat. From this moment, you are the one, my dear. You are the one, my dear. And I will not think about anyone else but you.
From this moment, I have been blessed.
Happiness of you and for your love. And for your love, I breathe my last breath. My friend, what are you saying, Shania Twain? Remind me, remember, you don't breathe the last breath for someone.
Last breath from this moment on.
I give my hand to you with all my heart. Man, you guys are good, man. You guys are my G's, man. You have reminded me a long time ago, when I was telling Mama Einstein and Mama Peterson, you know, I've called you like 3 times, you are not picking, Where are you? Where are you, Why are you not picking my calls, you know? I cannot sleep without you picking my calls and me getting to know how you are doing. Those were them days, my good people. Those were them days. Those were the days, man. But right now, she tells me, hey, Big Daddy. She calls me Big Daddy nowadays. Not Are you doing okay? Why are you late at home? I tell him I'm at work. Oh, continue with the hustle, you know. Love grows gradually, and the stages of love are different. So, T-Beauty, thank you so much for bigging up me and telling me that you have a Kenyan boyfriend. Or is it a Kenyan girlfriend? Boyfriend. Hey, well, thanks a lot for telling me you have a boyfriend, but you don't fall in love. Always do what? Gradually get in love. I'm telling you that protect your image, protect yourself, protect your emotions, and when you get in love, you sing that song. Yes, I have a here for, let me see, someone is calling. I'm here for for an hour, your channel. No, T-Beauty is still working it, but can help me by playing my playlist. Yes, we will be forever and always, my friend. Get a person, let me tell you, my friends, don't get a person he looks good, he looks hank. Get that hankness and that beauty in that person, yes, but get a person you can still be with this person even after this person messes a little bit, but you still say this person is my person, I cannot do anything, I'll forgive, and we continue. Get the person. So we have talked about antenatal care, and people today are not asking questions about antenatal care. The questions you are asking today about love, Bwana. About love. Let's love each other. Let's get to know each other. Anyone with any question? Anyone with question? Thank you, T Beauty, for telling us you have a Kenyan boyfriend. That is a very good thing. When you are in Kenya, maybe you will meet and talk. We will meet and talk, and I give you guidance. And the people that we have been in love with the same person for more than 10 plus years. I'm Josh. You should do live streams. Yes, you see. So anyone who has a question, my friends, today let me ask. Today ask questions, guys. Please ask questions. Why do you just go and keep silent? Ask questions today. Random questions. Anyone with any question? Any question, any question means it's not even about medical, but mental health and general social life is even a question. And you sing for my daughter happy birthday. Let's sing for my firstborn happy birthday. Happy birthday, Einstein. I know she's watching. She watches me while I'm live. Happy birthday, Einstein. Happy birthday, dear Einstein. Happy birthday to you. And then, how old are you now? She's 9. How old are you now? Daddy loves you so much. Happy birthday, dear Einstein. Is it your daughter's birthday? Yes, it's my daughter's birthday, and I wanna sing for her on this live. She's watching. Happy birthday to you. Welcome to Einstein. I know you are watching. You continue being a brilliant girl and loving daddy always. And always, yes, being a good girl who follows instructions and always who follows what I say. Happy birthday, princess. Yes, I wish I could be home. You could see her. But I'm not home right now. Maybe you'll see other videos. She's at school. They did a birthday for her. And now at home, she has the friends that have come to eat another cake. How are you celebrating a birthday? Or how have you? I sent a cake to their school. Goodies to share with the classmates, with the friends in the afternoon. And at home, she's there celebrating with other friends at home. Today it's her day from 2 p.m. till she goes to sleep, because tomorrow is school again. I hope it could be a weekend. I could take her somewhere good to celebrate. I'll see you on the other side. I gotta get a call. It's okay, T Beauty, no problem. It's okay, T Beauty, no problem. Blessings everyone to, and even those people that are here, those people that have come here, that are connected with us. Thank you so much. Okay, TBT, I appreciate. Also, upcoming premiere, you'll welcome at 8 p.m. Okay, nice one. I'm Josh. So, everyone who is watching, no one has a question. I'm waiting for a question. No one 567. I've been here for 2 hours. Wait, singing how you are my lady and you are my love. And wherever you reach for me, I'll do whatever I can. Give me one question, I answer, I go now. Anyone with one question, I answer, I go. Anyone with any question? Now, I'm not going if you are not asking me any question. Ask me any question, my friends. Ask Benjamin the wise guy. Ask the doctor a question, my friends. By dog have to travel. Thank you, Majay. I'm just getting out, even me right now. I'm waiting for 1 minute to hit 7 o'clock. Then I go. And you guys are not asking me questions. So 7 is here. So bye. Bye. See you. Between singing and medicine, what makes you happy? All of them. But singing is, I like music. I like dancing, music. All of them makes me happy. Because when I help a person and that person becomes better, says my pain is gone, it makes me feel better more. So both of them are therapeutic to me. Both of them are therapeutic. That's the last question. I asked one question and bye. Let's meet again the other time. Bye. And this